30% of Americans have not been to the dentist since before the pandemic in 2020. Today, I have with me Sonia Chopra, DDS, a board-certified endodontist, TEDx speaker, author, and eSchool founder. Dr. Chopra argues that oral health is extremely important. Teeth are the first step in the digestive process. They are absolutely crucial to the body's ability to receive energy and nutrients. It also affects how we breathe, sleep, and to me, even more importantly, smile. Dr. Chopra, welcome to the show.
Thank you so much for having me today.
You know, I was reading your full story the other day, and it struck me that at birth, you were born missing 8 teeth. Is that correct?
That's right. So you can have congenitally missing teeth, and I just happen to have all 8 of the most common ones.
Oh, wow. Wow.
Yeah.
So what did they do for that? What happens?
So I didn't really notice it until I started to get into my adult dentition. So as I was a child, it didn't really have an impact on me. But then as I started to grow up and, get into my teen years and I exfoliated a lot of my baby teeth, I realized that nothing was coming into its place. And the only thing you can do at that point is to replace those teeth. So I always say I was born to be a dentist because that just put me into the dental chair all the time. And so my mom was on a mission the summer after I graduated high school. It was 1995, and she wanted to make sure that I had a full complement of teeth. So she sent me to the dentist every week that summer, right before I went away. And the dentist started replacing my teeth. And then right after that, I developed a really bad toothache. Do you want me to go into that story? Because it's a big story.
Absolutely. Go for it.
So that's kind of the story. This next part of the story is the story that really brought me here to what I do today. It was thought that because I had recent dental work, that the toothache was a result of that recent dental work. So it kind of threw people for a loop. They really didn't know where my pain was coming from. I would go to the dentist and they would look at me, they would do some tests, they would take an x-ray, and they would see nothing wrong with my teeth, but I was having a significant amount of pain. And this kind of going back and forth to the dentist went on for about 9 months. And I could tell my dentist was getting very frustrated, and he ended up referring me to a lot of people, even medical professionals. So outside of the dental world, I also saw some clinicians, and nobody could really pinpoint my pain. So 9 months in and out of this like discomfort finally led to me having an abscess because the infection was not treated fast enough. And I had a big abscess. I was now sent to the oral surgeon. The oral surgeon was very hesitant on taking my tooth out because that was the instructions on the referral slip. And my mom was just trying to get me out of pain at that point. And I would do anything to get out of that pain. And so they numbed me up. They took my tooth out. And when I was fine while I was numb, but as soon as that anesthesia wore off, I still had my same toothache. And so I realized that, wow, okay, they got it all wrong. And I was still in this saga of where is this pain coming from? Finally, I was referred to an endodontist, which is a root canal specialist. And that endodontist found my source of pain, saw that I had actually cracked a tooth, and that crack was very difficult to identify. Cracked tooth syndrome is actually one of the hardest things to diagnose in dentistry. And I cracked a tooth. That crack became a doorway for bacteria to get in. Bacteria killed my nerve and gave me this abscess. And so that endodontist did a root canal on me, and I swear he saved my life. And that's why I became an endodontist myself. So I'm a tooth saver to the max because I am very sensitive to losing teeth. And after being born without 8 teeth and then having to lose a 9th, that was very devastating to me. And so I found this profession that actually saves teeth, and it made me feel wonderful. And it made me trust my body again, which was kind of neat. And yeah, that whole event, the whole episode in my life really made an impact that I ended up going to dental school. And then after dental school, decided to specialize as an endodontist and started my own practice. And I've been doing that for 15 years.
Oh, I love this so much because
Yeah.
you took your pain and you turned it into your lifelong purpose, which I think so many of us in health, whether it's health, fitness, nutrition, whatever the background, doctors, medical professionals, a lot of times we have our own story of
Yeah.
something we've gone through that leads us down that trajectory. I,
Yeah.
I want to talk a little bit about what an endodontist, you said they specialize in root canals. Can you go, because I know we have a periodontist, which is the
Yes.
gums. Can you
Yep.
kind of describe exactly what this specialty is?
Yeah. So I think it's first important to note that dentistry is so specialized. And I think it's really easy for people to say, hey, I want my dentist to do everything. But that's kind of like asking your OBGYN to do brain surgery, right? And if we apply the same rules in medicine to dentistry, we'll see that there are a lot of different specialties. So, like you said, the periodontist deals with the gum and the bones, orthodontists deal with braces and moving teeth, oral surgeons tend to do more surgeries and wisdom teeth removal. We have pediatric dentists who deal with children, and endodontists deal with root canals and saving teeth. So we try to not take out teeth whenever we can, and it's really neat what we can do now and the things that we can do to save teeth. So we go to an extra 2 years of training beyond dental school, and then that's all we do. So in my practice, it's really the only procedure that I do. And I do that 8 to 10 times a day.
Wow. I was thinking as you were talking how important dental health is, and I've heard that it can affect even internal health. Is that true?
There are definitely a lot of studies that correlate more of the periodontal disease, so when your gums and your bones are infected, to cardiac disease. So if we can keep this beautiful temple, this beautiful gateway really healthy, we are going to impact other systems of our body.
I see. Now, why do you think Americans are so reluctant at this point to go to a dentist to seek the care that they need to really take care of their teeth? What do you think's going on here?
I think it's a conglomerate of things. I think it is something that we don't value as much as we should. That's part of it. We have 32 teeth. So, hey, if I lose one, it's okay. If it's in the back of my mouth, it's okay. But funny thing is, we don't do that with our fingers, right? If we have 10, if one gets infected, we don't just chop it off. So I say to people like these beautiful white temples in your mouth should be just as valuable as your fingers, as your toes, as your hair. I think there is a story around dentistry that it can be painful. So there's a fear involved around there. So some people are truly fearful, and that prevents them from going to the dentist. I also think there's a story around dentistry that it's really expensive, and that can prohibit people from going to the dentist. So I think it's value, it's fear, and it's expense. And we are kind of in somebody's very sensitive zone. We're working on people's faces. It's your body buffer zone, and it's a tender area. So making sure you find the right person, the right dentist that you connect with is also super important. And sometimes people just haven't found that person. So I do think it's a mishmash of stuff. Is that fair?
Yeah, that's what I was thinking too. The expense and insurance often is not adequate in this area. I know mine is, I feel like I still wind up with a big bill at the end, despite what
Right.
insurance, I mean, I'm thankful for the help I get, but
Yeah.
that's part of it. And so I don't know what the answer is here, but I do believe, yes, that there's a great reluctance with that.
Right. So it's interesting you say that because dental insurance has really not changed over the years, even though inflation has, been a thing. So a crown used to cost $50, and you had the same benefit amount in your dental insurance of $1,500 max for the year. So it's so different. Dental insurance is so different than medical insurance. And I think that really confuses people. It's more like a benefit. It's more like a gift card as opposed to insurance. And so if you're really not focusing on prevention and trying to, stay ahead of things, that's when things get really expensive. But if you're fearful and you don't go in, look at all the people that didn't go in because of COVID. And now we're seeing that they have all these cavities and they do need my services. I always want to be like the last resort for everyone. I try to keep people out of my chair when possible, but I'm here when you need me, right? But if we let things accumulate, like what happened during COVID, then things are going to get a lot more severe and a lot more expensive. So focusing on prevention is great, but also having a really good understanding of what your dental insurance is and isn't going to do. Because if you think about it, it's only going to pay for one tooth a year. And if you just go based on what your insurance is going to cover, you're going to create that accumulation that we're trying to prevent.
Right.
And there's no changing that insurance. They will never change. They're getting worse. They're covering less and less with time. So I don't think it's really beneficial to have dental insurance. I think it's beneficial to go in and really just take care of things, find things while they're small and treatable, and before they blow up and become a mess.
I think you make a really good point, because I've seen what happens when like the older people begin to lose their teeth, and they kind of, I know my dad's generation did not see the value in dentistry. And so then by the time he got into his older years, I mean, they were pulling teeth like crazy, and he couldn't enjoy the foods. He always enjoyed a nice steak with the potato. You could still
Yeah.
do the potato, but he couldn't do the steak. And I could see some of that enjoyment of life going down. And I don't think people really think that through.
Yeah. I mean, your teeth are there for a very good reason. And nourishment, like you just said, is a big thing. Hydration, even just breaking down things. I mean, we are now seeing what like having softer foods are doing to our bodies and our airways. We're not breathing as well because we're not chewing as much because our food is overly processed, right? But we need to chew, and we need our teeth to chew. And when we chew more, we breathe better. And there's all these connections. And I think it's really easy to say, oh, I don't need that back tooth, but you actually really do. And I think it has a big thing to do with longevity.
Yes, you bring up an excellent point with the hyper palatability of food that's in the processed food. It just goes right down, and it's
Yep.
designed to be that way. If you think of the fast food burger, you barely have to chew it.
Yep.
Where if you
Yeah.
make your burger at home and you're loading it up with veggies,
Yep.
and you're actually having to work, and we are
Yep.
designed to chew, not to just,
Yep.
basically almost drink our food. You talked earlier about the root canals. Now, what is there a time that people are jumping too quickly into that procedure? And then what are some of the myths that surround a root canal?
Yeah, so diagnosis is key. And I've been actually keeping track of this in my practice. And I've found that 25% of the patients that are referred to me to get the root canal done actually don't need it. So you have to be very careful and that making sure your provider is actually doing the proper diagnostic tests. And so that's always step one for me. So many people say to me like, oh, well, what if my general dentist told me that I need a root canal, why do I have to pay for another consult at your practice? I'm like, because I'm their checks and balances. I really want to make sure that this procedure is warranted. And then I want to orient you on what to expect, because your root canal is going to be so different than this other person's root canal. They're not created equal, and they're very different because the anatomy that exists inside the teeth are so unique. And that's what we as providers really need to be prepared for. So understanding that as the patient and trusting us to do our best, I think is really important. And I think there is also a lack of trust between patients and dentists for some reason. We're kind of like the car mechanic of the medical world. And I want to be able to develop more trust between patients and dentists, especially when you find a good one. So some of the other question was what are some of the
The
myths,
myths.
the myths
Yeah,
around?
myths about it.
So there's a lot of bad press about root canals on the internet, and that makes me really sad, because I have found in my 15 years of doing just root canals that root canals are actually very regenerative and very healing procedures when they're done properly. Now, there's two cardinal rules that you have to follow in every root canal, and that's you have to find every canal in the tooth, and you have to get to the very tip of that canal in every tooth.
Right.
And that makes this procedure very technique sensitive. And when those rules are violated, which happens quite a bit, 50% of my practice is me fixing root canals that were not very well executed. And that's sad. And I hate the fact that by the time somebody meets me, they've spent several $1,000s on this one tooth. And I would rather they spend it on like a bucket list vacation or a transformative weekend at a conference or something that really changes their life, but they're spending it on one tooth. And so that's why I'm so passionate about this type of education for the public, because if they know that there is a specialist for such a thing, because some people don't even know that an endodontist exists. But if they knew that they had a choice of seeing their general dentist or a specialist, they may make a different choice. And then that root canal may have a different outcome. Who knows? There are some general dentists that are very good at root canals, but some people just want to go right for the specialist. So I think a lot of the myths and the bad press that root canals get come from the fact that we just don't have enough education about it. And while we're in dental school, do you know that the requirement for root canals is like 2 to 3, max 4 teeth before you graduate? So that's like if you delivered 2 babies in medical school, you're allowed to deliver babies. Like that's a big deal. And so we are falsely educating these dentists. And so they're doing the best that they can with the resources that they were given. And they're almost expected to do it when they're outside in the real world, because, well, 80% of the root canals are done by general dentists and only 20% are done by specialists. So if there was just more training involved and we had more experience while we were under that educational roof, I think we would have better outcomes. And I think we would debunk a lot of myths, because what I see in my practice is that a root canal done right, when you have a bad infection, it actually resorbs a lot of the bone around the tooth. It eats away the bone, the infection does, not the root canal, which is, again, a myth that many people say it's the root canal that's eating the bone. No, it's actually the bacteria that's creating an immune response within the body, and that immune response is eating the bone. The moment you remove the bacteria, because you found every canal and got to the end of every canal, then you're removing the etiology, and now the immune system can respond in a different way and heal that bone and redeposit and regenerate that bone. And so you get these shadows on the x-rays that now fill back in with bone, and then the shadows disappear over time. And bone takes a little bit of time to heal. So you usually see that healing in about a year. So you have to be patient with it. And so I always do a 1-year checkup on my patients. And 1 year, I love to show them the x-ray. I like to show them the shadow x-ray when they were infected, and then the 1-year checkup where the shadows completely resolved.
Wow, there's a lot that goes into it. A
It
lot.
is. It's a lot. And I could sit here and talk your ear off for days, but I think if I was a patient, I would want to know more. And that's why I want to bring up this conversation.
No, it's really important. I mean,
Yeah.
with people not seeking dental care.
Right.
Now what should somebody do? Okay, let's say they're having pain. What are the early signs that we should be paying attention to?
That's a great question, because sometimes a nerve, like a tooth, can die and you don't even have a sign. And sometimes it can be a painful death. And sometimes you'll be like, oh, that felt funny. And then it'll go away and you'll just ignore it. So mainly when it comes to a tooth nerve starting the disease process, you're going to see cold sensitivity first. You'll take a sip of cold water and be like, oh, that was sensitive. Or you'll breathe in cold air on a winter day and you'll be like, that's sensitive. And then it'll start to linger. You'll be like, oh, that was 3 seconds before, but now it's lasting for like 30 seconds, a minute. That's not a great sign. That's telling us that the nerve is starting to change, and it only changes like that in the presence of bacteria. So either there's a deep cavity or you've cracked a tooth, and that's a hard one to diagnose because you can't see those cracks a lot of times, or maybe there was some trauma to the tooth. The next sign is pain to heat. So you'll see it's temperature mainly. Cold comes first, heat comes next. Heat is a definite sign that the nerve is dying. So if you're having your hot cup of coffee in the morning and it zings you and it throws you to the floor, that's a tooth. Okay. And then the other thing is when the nerve dies painlessly, sometimes you can get a little bump or a pimple on your gum that may be sore when you press on it, or sometimes you'll get biting soreness. And that won't be all the time. That'll be intermittent because your body will mount an immune response to kind of fight the infection. And then it'll think, oh, I just won the infection, right? And so it'll back off. And then all of a sudden the bacteria, the infection has a chance to grow back. And then the immune system will be like, oh, I thought I got rid of you. And then it'll mount the immune response and push it back down. So you have this intermittent kind of sensation. And because it's not a constant pain, some people don't seek help. And that's when you start to see those bone shadows, the resorption of the bone getting bigger and bigger over time because people left it there a little bit longer.
Yeah, that's how we found my daughter's problem. And she was young and she had a little, what looked like a little bump or a little sore or a little cyst. And we're like, what's that? So I took her
Yeah.
right in and sure enough, yeah, she had a problem and she was young.
Yeah.
How much, now you talked about your own personal story. I was just telling you about my daughter. How much does genetics play and how much does lifestyle factors, like maybe even nutrition or just our daily habits, how we brush, floss, things like that? How much does all this weigh in?
It all has an impact. So it's funny because my mom's never had a cavity. However, she does have all the congenitally missing teeth, as I do. So I got that from my mother, but I wish I got the fact that she didn't have any cavities because every time I went to the dentist, I had 8 cavities. And so I know that my mouth has more karyogenic bacteria. I have bacteria that causes decay, whereas some people may not brush at all and they never develop decay. They may, because their bacteria, their oral microbiome is so different. Some people have the bacteria that causes periodontal disease, but not decay. And then there's people who has nothing. And if I don't, like, I need to floss every day or I feel it. I can feel the fuzz. So I'm always surprised at people who don't feel the need to floss. But if you have a tendency to get cavities, you want to make sure you're flossing every day. You may even need fluoride, which is kind of like a no-no, right? But there are some benefits to it. But if you don't get cavities, you definitely don't need the fluoride, but you should still floss every day. So your genetics plays a role, your diet plays a role. And, if you are one of those people like I am who has bacteria that causes decay, you do want to change your diet. I don't want to have sugary things because as soon as I have something that's sugary or a carbohydrate, the pH in my mouth is going to drop and it's going to become an acidic environment. And then the bacteria is going to be able to break down, my teeth and that enamel. So I have to behave differently than somebody else. So I do think it's very specific to each of an individual as well.
Yes, I've seen that. My brother's had a really hard time. My poor brother, I always pick on him on this podcast, but he's had a really hard time of, having to have implants over the years, having teeth die out on him. And I'm sure part of that was not seeking a dentist because of financial reasons and other reasons and fear of the pain, but he's had quite a hard time. Now, you touched on something interesting that I don't want to pass up, and that was the fluoride, because that is like a hot topic.
Right.
And I hear a lot of naturopaths, functional medicine doctors saying, no, you need to do the natural toothpaste. And I actually did try that for a period of time, and my teeth got really sensitive. And so I had to go back to my other protocol, and things just weren't feeling right. And so I'm
Right.
glad that you touched on that because I think sometimes, there can be some fear mongering around things and it's not
Correct.
necessary.
Correct. I mean, you have to be mindful of like how much fluoride is in your water, right? And then how much fluoride do you as an individual need? I don't think it's fair to say like it should be forbidden because there are some people who really need it. Think about children and think about a geriatric population. They don't have manual dexterity to really clean. So how do we prevent decay in both populations? You may need a little fluoride, especially, the younger guys are, eating whatever, and they definitely don't clean their mouth as well until they get a little bit older. And then as we get older, we're losing our saliva production, which is our buffer, which saves us from decay. So as we get dry mouth, because maybe we're on medications or maybe we just don't produce as much saliva, we're going to increase our rate of decay as we get older. Plus, we can't, if we're arthritic, we can't get to those hard to reach places that fluoride may become beneficial. So I think it's hard for me to eliminate fluoride. I saw what eliminating fluoride did to my daughter. She also had 8 cavities. And I was so embarrassed because here I am, the dental provider.
Wow.
And I go to the pediatric dentist and my daughter has 8 cavities. And the only thing I changed was her fluoride toothpaste. So guess what? Guess who gave her cariogenic bacteria? I did. And so I now need to treat her mouth like mine. Now my other kids, they don't have the same problem. So I don't need to push it on them. So it really varies.
Yeah, it does. And that bio-individuality, I love that you hit on that, because you sometimes hear, oh, that's all bad. Oh no, everybody needs it. And it's not a one size fits all, for sure.
Right. And you don't want to overdo it. Like, you definitely don't want to overdo it on fluoride, because if you have too much in your water, you can actually have fluorosis. So you get the white spots on the teeth. So it's really important to know how much you're getting and how much do you actually need. What's the minimum amount that you need for you is what I think is important.
Now, you talked about the geriatric population, and I'm now in my 60s. So as I'm getting older, I'm not geriatric. I start to think about things a little bit differently. And you were, talking about the dexterity and some different things. And as you were speaking, I was thinking about how the thirst goes away as we get older. We're not aware we're thirsty. Like, that's something I really push working with my health coaching clients is, sometimes you're not going to feel that thirst and you'll get dehydrated. Does that play into it too? If somebody, you talked about the saliva, but if somebody's not hydrating.
Yeah. Drinking water really does help keep those cavities away. So I think that's an extra benefit that you can tell the people that you work with on why staying hydrated is important.
No, I love that. I'm going to be using it from here on out.
Good. Keep them out of my chair. We don't want you in the chair.
Now, let's say somebody is doing a sport. Now, you see this more with people's kids, grandkids, and boom, they get that injury to a tooth and some kind, I don't know, a fall, a contact sport. How should that be? What should the first step be in a situation like that?
So this is a great topic that I feel like nobody knows the answer to. Like, just, it should be everyday knowledge, in my opinion. So a lot of people, let's talk about the avulsion, meaning there's an impact, whether it's a sports injury or maybe it's an accident. Maybe you just trip and fall, you fall on your face, and that can happen to anyone at any time. It's just, shit happens, right? And the tooth flies out of the socket. Most people, what they do is they panic, right? First they panic, and then they grab the tooth. They probably try to rinse it off with water, put it in a Ziploc bag, and they go to the emergency room. I am trying to teach people a different way, because there is a very important lesson here. The faster you actually get that tooth back into your socket, like within 30 to 60 minutes, the better your prognosis is going to be for your body to re-accept that tooth as if it never left the body. So I tell people, pick up the tooth, pick it up from the crown. So the white part, not the root, don't touch the root, but pick it up by the crown, which is the one the part of the tooth that you see when you smile, right? That one. So pick it up by the crown, and everyone's tendency is going to be, oh, I want to rinse it with water. You actually don't want to rinse it with water, but you're going to feel like it's soiled. It probably fell on the ground, right? You can maybe just take a little bowl of milk and just rinse it with the milk. Milk is actually better than water. Water is going to induce, it's actually, there's little fibers that attach your tooth into the bone. Your tooth is never just directly fused to your body. There's these little fibers called the periodontal ligament. And so your tooth is like a trampoline. Every time you bite, you have a little movement of your teeth because those fibers are what's attaching your tooth into the bone. So those fibers are what you want to keep alive. So imagine if you're scraping the root with something, try to clean it off or taking a Brillo pad to it, you're going to kill those fibers. You need to keep those fibers alive. So and they're typically on the root and they're not on the crown. So you want to touch the tooth by the crown. If you feel like that tooth got a little bit soiled, you actually just want to rinse it off with a little milk. If you're nervous about putting the tooth back in, milk is the storage medium that you want to use, not water. The best storage medium is called Hank's Balanced Salt Solution, but nobody really has that in their house. So the next best thing is milk. And I believe low-fat milk is better than full-fat. So use low-fat milk. But if you are brave enough to put that tooth back in the socket right away and then bite on a little tissue and then go to the dentist. Don't go to the emergency room because they don't know how to handle it. Then they're going to make you wait because the guy with the stroke is going to get precedence. And so if they're just going to put your tooth in a bowl of saline, which is actually the wrong medium, then your prognosis goes down by the second. So if you can get that tooth back in, make sure it's back in the right way, not backwards, right? And if there's multiple teeth that came out, make sure you got the right tooth in the right position, and then get to the dentist so that we can splint you. And then we want that to heal. And then about 10 days later, you'll have to have a root canal because the nerve got severed when the tooth came out. But getting the tooth back into the socket within 30 to 60 minutes is the key to life of that tooth. And your body will actually reaccept that tooth.
Wow, that is such good information. I did not know that because I was thinking I would have run it under the water, gone in, got the Ziploc bag, stuck it in there, gone to the emergency. Just exactly what you described is what I would have done. It just seems like the thing to do. Like, oh, that's dirty. We got to wash it off. And the milk, I did not know that about the milk. Why is low-fat milk better?
I don't know the exact reason, but they did a study and they saw that the low-fat milk did better. So another thing to consider is, now with FaceTime and video, like you could probably still be at the scene of the accident. And I've gotten on FaceTime with patients and I instruct them what to do and how. So you don't have to be alone in the process, my front desk, they know that if somebody experienced trauma, get me immediately. I can step away from my patient that I'm working on and I can walk somebody through it over the phone.
I didn't even think about the FaceTime. What a great tool.
Right?
Never even thought about it.
Yeah.
Now I'm going to shift gears just a little bit. You have an e-course. Can you tell us a little bit about what that is?
Yeah. So, wow, it's been 6 years. I started an endodontic online education platform called eSchool Everyday Endo Made Easy. And it was really based on seeing my own tooth story show up in my practice over and over and over again. And this was 20 years later. And I'm like, wow, people still don't know. So it really hit home that the endodontic education in dental school is not where it can be. And dentists really need that extra support. So I created this online course. And my goal is to make general dentists even better than they are at performing root canals or even just diagnosing, even if they're the ones that don't even want to do the root canal and they refer to a specialist every single time. Just being able to make sure that tooth is diagnosed properly is such a big gift that I can give them. And from there, I realized that was all online, right? And then I realized that there are a lot of dentists that need hands-on learning. That's just the way that they learn. So I created a live component where I take 5 dentists at a time. They come to my practice and they get to do the root canal under my supervision. Now, the CE that exists right now on how to do root canals is all on extracted teeth. There's no other live program out there in the US that I know of. But what's cool about this program is actually it's a give back program to my community. So if price is a factor for some people and really young people, I can't afford this root canal, so I'm going to take the tooth out. I've made, relationships with dentists around my city that, hey, if you see somebody who really cannot afford treatment and and they want to save their tooth, and their only other option is to take the tooth out because of finances, refer them to this program because they'll get their root canal for $100. And
Wow.
it's great. And then, and not only does the dentist get to learn like hands-on, but the patient gets to save their tooth. So it's great. And I wish there were more programs like this because there's such a need everywhere.
What a beautiful way to give back to your community.
Yeah.
What I love speaking with you is I can tell you really care. You care about your patients. You care about people. You want them to get the dental care that they need, and I love that.
Thank you. Thank you.
Now, I want to be respectful of your time, and as we begin to wrap up, first of all, was there anything we didn't talk about that you would like the listeners to know?
I think we pretty much hit it. I just want people not to be fearful of saving their tooth with a root canal, and be careful what you read online, and know that a lot of what you read online is antiquated. It's old news. And how I practice today in, using modern technology is so different than how I practiced on day one of my practice. So in 15 years, the technology has really changed in our world. And I tell everyone there's no better time to get a root canal than now. It's really neat what we can do and what we can save, and some of the success stories that we see now are quite incredible.
Oh, that's so reassuring. Yeah, I think the combination of old antiquated information, because you see this throughout the health field,
Yeah.
and then a lot of fear mongering. I see a lot of people just
Yeah.
saying something for the shock effect on, say, social media, for example. I do see a lot of that as well.
Right. Exactly.
So let the listeners know, how can they get a hold of you? How can they follow your work?
Yeah, so I mainly hang out on Instagram, and you can find me at Sonia Chopra DDS. That's Sonia with an I. I also have a website full of tooth stories and good resources, and that's soniachopradds.com.
Oh, that's wonderful. I'm going to put all that in the show notes, and also link to your TED Talk. You did a TED Talk, right?
I did, all about root canals and saving teeth.
I'm going to listen to that. I'm going to link to that as well. And I just have to tell the audience, Dr. Chopra is so gracious. Last week, we tried to record this podcast, and my Wi-Fi just suddenly went out, and we tried everything, and I'd moved the computer all over the all over the house. And she just was so patient and gracious to rebook this time and speak with you, the listeners. So thank you, Dr. Chopra. I appreciate you coming on.
Thank you. It's been a real blast and an honor to be here with you today. Thank you.
Thank you. And to our listeners, wherever you are in the world, we wish you every blessing. Bye for now.